Hello everyone, myself Dr. Jyotirmay Hegde, practicing ENT and skull-based surgeon at Manipal Clinic Brookfield and Manipal Hospitals, Varthur Road, Bangalore. I'll be talking in brief about obstructive sleep apnea, also commonly known as sleep apnea. It is one of the very few underdiagnosed conditions because many a times the patients don't approach or don't feel that they have some abnormality. Most of the time it's always felt in the society that snoring is normal. But you should also remember that one of the important features of obstructive sleep apnea is not just snoring. Along with that, you tend to have other features as well. Along with the snoring, you can also have that abnormal headache when you get up in the morning, or once you get up in the morning, you may feel that your sleep is not good at all. The quality of the sleep spent was not at all good. There may be disturbed sleep, frequent urination during night, and you can also feel that there is associated lack of uniformity in the sleep. That is, suddenly there may be episodes of arousal during the sleep. Sleep apnea is nothing but a sleep disordered breathing, which usually happens because of partial or total obstruction of the breathing apparatus in the airway. So when we have a breathing apparatus, we have an airway which starts from the nose and which goes even to the lungs. So anywhere from the nose to the lungs, if there is a partial collapse or total narrowing of the airway, it leads to obstructive sleep apnea. So usually this obstructive sleep apnea happens during the sleep, as the name indicates, because when we were awake, the airway is usually solid, because they have a normal muscular tone and it doesn't collapse. Whereas when we sleep, the muscle loses its tone, and what is like the airway is a circular apparatus collapses, and because of which whatever air goes from the nose towards the lungs, it starts fluttering. And this happens at multiple levels, right from the nose till the throat and the neck. So because of this, there is a loud sound which we call it as snoring. So snoring is one of the most important feature of sleep apnea. Along with the snoring, you can also notice that a patient has disturbed quality of sleep. When they get up in the morning, they feel that they are not at all fresh, or the sleep was not at all good. Along with that, they may see that they have significant headaches. Okay, so these are the things which may be seen usually in obstructive sleep apnea. When you start sleeping, you frequently see that when they start breathing, there will be collapse in the airway. So because of which there is decreased oxygen supply to the lungs and to the brain. And then the brain in turn stimulates, and it stimulates the breathing apparatus, and suddenly they have an arousal. So there may be intermittent episodes where the patient is not breathing at all, and suddenly they may have a deep arousal. These kind of things. So this is usually suggestive of obstructive sleep apnea. Obstructive sleep apnea is important because it's a silent epidemic. It's a silent killer in the society. You will notice that whenever the patients have obstructive sleep apnea, around 25% of the patients tend to have heart and brain related side effects. Like they may get silent cardiac effects like heart attacks. Along with that, they may have blood pressure which is raised, also called as hypertension, and they are more prone to brain disorders like stroke. Around 40 to 80% of the patients with stroke tend to have some kind of obstructive sleep apnea. One is from the above mentioned symptoms, which I usually discuss now. Apart from that, we do something called as sleep study. Okay, so the sleep study is a simple study which is usually done to know whether you are suffering from sleep apnea. These services again are available at Manipal Hospital. A sleep study is done, and we come to know whether you are suffering from obstructive sleep apnea. Once the obstructive sleep apnea is diagnosed, then is the treatment. First, it's usually managed with weight reduction and the underlying causes, like if sometimes there may be just a hormonal disturbances, like the changes in thyroid level like hypothyroidism, or other causes which may be causing obstructive sleep apnea, that has to be corrected. Once we do that, if there is still any treatment for obstructive sleep apnea wherein the sleep apnea is not totally gone, then we start something called as CPAP machine. Okay, so it's called as continuous positive airway pressure, wherein whenever the patient sleep at night, they should be using this machine. It will be delivering constant pressure of air inside the nose, and the patient will be able to breathe normally without causing any snoring or sleep apnea. In case the patient is not compliant with CPAP machine, or he or she is not able to tolerate CPAP machine, then we have to go for surgery. So these surgical facilities are mainly done so that the airway is patent enough. It may be right from the nasal cavity itself, wherein the septum, or the partition between the two nostrils, may be deviated or bent. It's called a deviated nasal septum. That has to be corrected. Or something in the throat, everything may be narrow. The air space has to be dilated. All these facilities wherein the surgeries are done for obstructive sleep apnea are done at Manipal Hospital, Varthu Road, as well as Manipal Hospital clinics in Brookfield. All these things can be easily treated. It's very important that since it's a silent epidemic or a silent pandemic, it's very important that it's diagnosed at an early stage and the treatment has to be given effectively.